First, it was the elderly population and frontline workers, then those in the tourism sector and the adult population of the country. Then in 2021, we also saw the rollout of vaccines to children 12 years and older. Today, the Ministry of Health and Wellness, at a media sensitization session, confirmed that they have secured pediatric COVID-19 vaccines for children ages 5 to 11. The Pfizer pediatric vaccines are being donated by the government of Slovakia.
We are privileged to be recipient of a donation from the government of Slovakia. We are receiving 124,800 doses of Pfizer pediatric formulation, and the cost of each dose is $20.87.
This batch of pediatric vaccines will allow for the immunization of up to 85% of children in this age range with 2 doses each. The Ministry of Health and Wellness has been working with the Ministry of Education to inform parents of the rollout, which is set to commence in schools across the country on May 30th. Dr. Natalia Baer of the Ministry of Health and Wellness and pediatrician Dr. Cecilia Eck shared details.
The target population, based on the data that we gathered from the Statistical Institute of Belize, children 5 to 11 in Belize is a total of 73,119. And we were informed by our team that is at the Philip Goldson International Airport, prepared to receive the vaccines today, that there has been a delay and the vaccines will arrive until Saturday.
It is a boon that we've gotten it. We again are ahead of most of the countries in the world to get enough vaccines to even give our kids 1 dose and to start on the 2nd dose. So our hope is that most of the kids, we aim for 95% coverage, will get at least 1 dose prior to going for holidays, and hopefully most of them will get the 2 doses.
Since we received the confirmation of the donation, then we started to work with the District Education Center and the Ministry of Health and Wellness local teams in the districts, reaching out to the principals, to the teachers, to the parents, because every parent should receive information, afford them the opportunity to ask their questions before signing the consent form, which is a requirement. So we haven't heard or received any negative response from the education sector.
The recommendation for this age group is 2 doses 21 days apart. A booster shot is recommended for children who are immune compromised. But similarly to the vaccination rollout for children 12 and older, it is expected that the reaction from parents will be a mixed bag on whether or not their children should be vaccinated. Drs. Baer and Eck share the benefits of inoculation.
COVID-19 is not a disease to play with. It have long-term consequences, and we are still learning about the virus, and Dr. Eck can help me here, that it's not a cough and cold that we thought at the beginning of the pandemic. We know that now it's a systemic disease. And so why expose someone to get COVID-19 when we have a vaccine that can protect them from the infection? And if they do get infected, then it will protect them from severe illness and the need for hospitalizations.
Our track record on giving vaccines to our kids is impeccable. Now what's happening is we get a new vaccine. It has been used throughout the world to prevent COVID. We do know that even though the risk of severe illness to children is very low, it still does exist. And if we give the vaccine to our children, we decrease the risk of them getting ill and getting the need to be hospitalized. And thirdly, approaching that golden figure of herd immunity.
The vaccine will arrive in country on Saturday, and rollout will begin on Monday, May 30th at schools and public health facilities and vaccination sites countrywide. Duane, Moody for News 5.